There we go. Okay. So this is the American Music Therapy Association's definition of music therapy. When you're asked, what is music therapy, this is what every music therapist is supposed to tell you. And so it's the clinical and evidence-based use of music interventions, and it has to be done by a board-certified music therapist. We're going to talk about, there's different levels of training for music therapists. You can be a practicing music therapist with an undergraduate degree. The training is very different. Most people who come across a music therapist in their everyday kind of workplace, whether it be in schools, a lot of them are that level of training. You'll find undergraduate, they come from Anna Maria, they come from Berkeley, and Lesley University has a graduate degree. So there's a difference there. The undergraduate trained music therapists cannot bill insurance, and they're also more group-oriented in their training. So they're not necessarily on a re-educative level in terms of looking at therapeutic goals. So there is a difference. I think a lot of people that have come across, they say, well, we had a music therapist, they did the same songs every week, or we had a music therapist, it really wasn't that positive of an experience clinically, it was more recreational. And usually, if you're having a recreational music therapy experience, you have a undergraduate trained music therapist. So just to be aware of it, don't shut us all off. If you have a recreational experience, it's not a bad thing, it's just different. So I always say, well, that's great. That's a nice definition. It doesn't really tell us anything about music therapy. It's cool, And so what I wanted to talk about a little bit was explaining what you can expect to see in an actual a clinical music therapy session, and how it's evidence-based practice. And so it's very hard to make a standardized assessment for music therapists because my itsy bitsy is going to be very different from your itsy bitsy, very different from yours, right? It's a very subjective experience in music. But what they're trying to do is take other, like the certs, they're trying to take other assessments and kind of build off of standardized tests, a way to at least measure where's the issue and how do we fashion interventions that are going to be effective, and how are they measurable. So keeping goals measurable and yet humanistic at the same time is one of our biggest challenges as music therapists. There's tons and tons of presentations on it when we go to national conferences because everybody wants to keep that human, individual kind of connection with their clients, and yet at the same time we need to be making sure that we're making progress, we're moving forward, and so how to measure goals. And so there's a couple different types of music therapy that you'll see on the East Coast. More so, you'll see individual-based music therapy. The client comes in and has aphasia. How are we going to address aphasia through music therapy goals and interventions? If you were in California, you tend to see more neurologic music therapists. It sounds fancy. It's really not. It's just behavioral-based music therapy. You're using music in more in a cause and effect way. So I can think of an example being, a fill-in-the-blank song is something that you would see done a lot by neurologic music therapists. The itsy bitsy spider went up the water. Thank you. Beautiful. So, and then you tend to see a music therapist who's well-rounded is going to take from lots of different types of music therapy and kind of combine them all to make the most effective practice. If you see, it's the same thing as if you took ABA therapists and you hear a parent saying, I feel like it's training a puppy, it's my child, we have a problem here. Well, if an ABA understands, the true meaning of ABA, it's not like that. You know what I mean? True ABA is much more well-rounded, understands that the child is an individual, and takes it to that next level of, yes, we're learning how to do things through cause and effect, but it's more than just a trial. It's more than just taking data. So, and then at Worcester Music Therapy Services, we tend to be music-based, and we tell this to all our families because parents are coming in and they're saying, he's not talking, I don't know what to do, he's 4 years old, how can you please help me? We've tried everything. And the reality is the child coming in, I say to my parent, I understand that's your goal. They're a musician when they walk in the door here. It's music first. They're going to come in, and we're not going to pressure them. I know that there's a goal, and I know that we're going to write in his treatment plan that addressing his speech and language delay is our goal, right? and here's how we're going to do it. But when he walks in, I'm not going to sit him down and say, all right, it's time to talk. No, we're going to come in singing, and we're going to come in with open arms, and we're going to welcome a music experience. He's a musician first, and everything that happens after that that's beneficial is secondary. It doesn't mean that it's less important. It just means that the focus tends to be that the child is music, as opposed to the child is coming, and we really got, we really got to get that progress going, and it happens. It does. The progress happens. It's just the way that you look at the philosophy behind the work. Okay.